Welcome to Chapter 5, the Musculoskeletal System. Go ahead and review the learning outcomes for this chapter posted in the module and at the beginning of your lecture slides. Basically, in this chapter, the musculoskeletal system, we're looking at two organ systems that are closely related to the muscular system and which is the muscular system and the skeletal system. Skeletal muscle, we know, attaches to the bones of the skeleton, and because muscles insert into those bones, we can move about. So the musculoskeletal system also is responsible for maintaining our body posture, protecting vital organs, stores minerals in our bones, and generates heat through muscle contractions. So in this chapter, we're going to discuss bones, joints, and muscles. So let's take a look at the anatomy and physiology first. So when we look at the structures, the body has 206 bones in it. It's divided into the axial skeleton, so the bones of the head, the neck, and the trunk, and that appendicular skeleton, so the bones of the arms, legs, and the girdles. And the body has more than 700 muscles, and these bones articulate, meet at joints, where muscle contractions allow for different types of joint movements. And we know that the main functions of this system are for supporting body structures, moving body structures, protecting internal organs, storing the calcium and other minerals in our bones, producing blood cells, so our red bone marrow, and producing heat in our muscles. So be sure to review all the terms related to the bone structure. I'm not going to say all of these, but go ahead and go into the Stedmans and you can listen to the words stated I like to say them out loud, say the term like bone marrow, the pronunciation, and then state the meaning to help myself remember and recall the terms related to the bone structure. Here is a diagram of the major parts of the bone, and what it's looking at is a long bone, and then it even breaks down the type of bone tissue. So here we can see the spongy bone making up most of this long bone where those arrows are, and then a thin layer of the compact bone is seen at the surface there. Again, review the terms related to the skeleton and the bones. Again, say them out loud. Use some of the resources and Stedmans for those so that you can practice speaking them and saying them. Here's an anterior view of the skeleton with the major bones identified. Those certainly could be questions on this chapter's quizzes and the midterm exam. Again, here's the vertebral column showing the locations of the vertebra, and those are often referred to in medical terminology and in reading a medical record. The chapter then moves on to joints and joint movements, and joints are also called articulations, and they occur wherever bones come together. And joints are categorized by their movements, and the terms for the joint movements are based on the type and the direction of the movements. So again, you want to be sure to look through the terms related to the joints and joints movements and speak to those. Practice saying the medical term, practice spelling them. Lots of resources in the Stedmans and prep you to help you with that. Here is a diagram of a knee and the synovial joint of the knee. So review, here we see the naming of the parts of the knee and the joint here. Muscles, the chapter then moves on to muscles. And there's some animations and prep you on muscle extension and flexion. And we know that there are 3 types of muscle tissue in the body: the skeletal muscle, smooth muscle, and cardiac muscle. And muscles are composed of bundles of muscle fibers along with other tissues, and tendons attach muscles to the bones. Here we can see some movement of the joints, and you can see the abduction and adduction, and visualize how the movements of the joints occur. Again, practice the terms related to the muscle, the pronunciation, and review their meaning. Here is a diagram of the skeletal muscles of the body. You can see both the anterior view and the posterior view, and you can see there's a tremendous amount of information in this chapter. The 3 types of muscle tissues here. You can see the skeletal muscle, the smooth muscle, and the cardiac muscle here. And again, the skeletal muscle structure with the tendons and where they attach the bones. So be sure to, again, another diagram, the skeletal muscles are attached to the bones by the tendons. You can see that here. Practice the exercises, exercise 1 and 2, 3 and 4 and 5 in the chapter to get really familiar. There's a lot of information in this chapter, as well as the chapter 4. When we look at the word parts, important as we look at the parts related to the musculoskeletal system, review the combining forms and their meaning, the prefixes, suffixes, and then again the adjectives and other related terms. And make sure that you notice that where capitalization occurs and when to use a capital letter and when not to. And you can see most of these are not capitalized, unless here we see carpal tunnel syndrome when that is abbreviated as a medical term. That particular one is capitalized. So be sure to pay attention to that in your quizzes. I noticed a lot of people are losing points for that. Here we can see some information. They have some diagrams on arthritis. We can see progressive joint changes seen in the arthritic knee, and then some abnormal curvatures of the spine. The chapter moves on to common types of fractures, and so become familiar with some of those terms. The medical terms continue when we're looking at the bones, and again, it's just practice with the terms. Here's a great diagram view of the herniated disc showing protrusion of the gelatinous central portion called the nucleus pulposus, and you can see a cross-sectional view and a lateral view there. Again, lots of terms this chapter. Here we see a picture of when the bone is becoming less dense in osteoporosis, an x-ray of a normal hand, and then that bottom right hand is severely deformed from rheumatoid arthritis. So practice the exercises 13, 14, 15, and 16 in the chapter, and then the chapter moves on to tests and procedures related to this chapter, and these are common things that you're going to see. Again, here is another diagram showing the arthroscopic examination of the knee and the endoscopic view of joint interior. And then here is a whole body nuclear medicine bone scan, very interesting to view. Here's a CT or a computed tomography scan showing the postlateral elbow dislocation in a 13-year-old boy. And those are pictures A through D. And then an F shows the position of the screw and washer 4 months after surgery, where that is completely healed. Here we see an MRI picture, magnetic resonance imaging of a herniated intervertebral disc. You can see that where the arrows are. Surgical interventions and therapeutic procedures, go through those and say them out loud, become familiar with those as you move through the tests and procedures section of the chapter. Here's a diagram using arthrocentesis. Synovial fluid is being aspirated from the wrist joint to reduce inflammation here, and the upper picture and the lower picture is the surgical excision of tissue from a herniated disc or a discectomy, and be sure that you see that's with a C and not a K. A lot of people miss that on the quiz. Here is an x-ray showing the surgical fixation done to produce a spinal fusion, and you see the limited movement along the spinal column there. Lots of pictures in this chapter to help you relate. And here we see a suture of a torn tendon and a patient receiving cervical traction. Here's some orthopedic devices, a knee brace and a back brace commonly used. So medication, drugs, and therapies, be sure to review those and know who the specialties and specialists in these areas, and practice abbreviations, really important. So wrapping up, lots of practice with the skeletal muscle attaching to bones and functions together as the musculoskeletal system to cause movement. You know, joints where two bones come together, and there are different types of joints which are categorized by how they move, and really practice learning the names of the bones, skeletal muscles, word parts, prefixes, suffixes, test surgeries, and medication specialists and abbreviations in this chapter. Lots to do, so practice, practice, practice.